Good day. My name's Mike McNeese. I'm the city manager for City of Marco Island, and we're here today to put together a public information piece on the COVID-19 outbreak to talk to our community about things that are happening here. One of the things that I'm hearing a lot as we go about our day is that all of the information people are getting is from either the Centers for Disease Control, the federal level, from the State Department of Health at the state level, and everything that we're pushing as a city is back to those federal and state sources. And people are concerned that they're not hearing local information and they're not getting local recommendations from us. Now, first I want to explain why that is. There's a reason we're circling everything back to the Centers for Disease Control and to the state, is because they are the medical experts. They're the epidemiological and the public health experts. And so we want to be sure that whatever we say as the city is completely in lockstep with the recommendations that they are making, which is why we circle back and ask people to continually refer to those things. Now, that said, we do understand that there is some demand for local information. So what we want to do here is talk about some of the particular hot topics of the day in the last few days, today being March the 18th, and put out some current information. And I have some guests here that are going to help me do that. I have from the Collier County Department of Public Health, Christine Hollingsworth, who's their public information officer. From the Marco Island Chamber of Commerce, we have Diana Dom, who is going to speak to the business community on things they can be doing and to speak on behalf of the business community to help the rest of the public understand what things they are already doing. We also have a representative from the Collier County, the Collier County chapter of the Florida Restaurant and Lodging Association, Jacqueline Kuhn from CJ's on the Bay, who's going to speak on behalf of and to the restaurant and hospitality community on things that they're doing, things they need to be doing. And I think what you're going to hear as we go through these presentations, we are all pretty much on the same page. You're going to hear a lot of the same things, which is good because you really can't hear them too many times. So first, to talk about sort of the current state of the COVID-19 outbreak in Collier County and to talk about specific recommendations that people need to follow, we're going to hear from Christine Hollingsworth from the Collier County Public Health Unit.
We are reporting travel and community-acquired cases of COVID-19 in Collier County. We expect these cases to increase as testing becomes more readily available. Testing is available at the Florida Department of Health in Collier County and at local hospitals. Your primary care physician may also order a COVID-19 test through a commercial lab. Symptoms of COVID-19 include fever, cough, and shortness of breath. If you have these symptoms and have traveled to a COVID-19 affected area, traveled internationally, traveled via cruise, or if you have had contact with a COVID-19 positive patient, contact by calling your primary care physician or call your local health department. We all play a role in preventing COVID-19. We need to be proactive now. If you're sick, stay home. Do not touch your face. If you have a cough or sneeze, cover your mouth or your nose. Practice social distancing, at least 6 feet away from one another. Cancel or postpone all gatherings of 10 or more people. This includes backyard parties and barbecues. Use hand sanitizer only if soap and water is not available, and wash your hands repeatedly for at least 20 seconds with soap and water. Together, we can help stop the spread of COVID-19 and keep our piece of paradise safe.
Thank you, Christine. Next, we'd like to hear from Diana Dom from the Marco Island Chamber of Commerce to talk about and speak to our business community.
Thank you, Mike. As with all the local organizations, the Marco Island Chamber of Commerce closely is monitoring CDC guidelines and directives from Governor DeSantis. Our mission is to communicate communicate not only to our businesses, but also to the visitors calling into our office. On Tuesday, March 17th, a chamber communique was sent to our database of subscribers, updating them on the current CDC and state guidelines. In the communique was a listing of all the websites which provide up-to-the-date information from the CDC, Florida Department of Health, Florida's COVID-19 dashboard site, Collier County, and the city of Marco Island. You can access these websites by visiting the Chamber of Commerce's website at www.marcoislandchamber.org. We ask our businesses, our residents, and our visitors to follow these guidelines closely. Jackie Kuhn will be speaking to specifics to the hospitality industry. Please remember, American small business owners do not get the bailouts on unemployment or sick leave and are responsible for 49.2% of private employment in the U.S. We are begging you to do one thing every day and to support the small businesses during this crisis and also follow the CDC guidelines. Governor DeSantis activated the Florida Small Business Emergency Bridge Loan Program to support small businesses impacted by COVID-19. The Bridge Loan Program, managed by the Florida Department of Economic Opportunity, will provide short-term loans interest-free to small businesses that experience economic injury during this crisis. The application process has begun and will run through May 8, 2020. Senator Marco Rubio is also working with Senator Collins to unveil sweeping small business emergency economic relief. I want you to know how you can help Marco Island locals impact COVID-19. The Community Foundation of Collier County, a 35-year non-for-profit organization, together with the Marco Island Chamber of Commerce and the YMCA of Collier County, Marco Y, has activated its emergency relief fund titled Collier Comes Together to collect donations to aid in this COVID-19. The Community Foundation has experience and tools to rapidly deploy resources to Marco Island residents. Donations to this fund will help you address urgent needs such as food, medical expenses, rent, and loss of income from those affected. Visit cfcollier.org to make a donation. Please make sure to type in Marco Island when donating, and make sure you are donating to reputable 501c3 organizations. Check websites and share only validated information. Know your non-for-profit organization. There is opportunity for you to continue serving our community. Buy gift cards. Generously tip those waiting on you, either via dining out or dining in. Continue your membership with local businesses or non-for-profits. Please remember, our businesses rely on you. They are here for us. We now need to be here for them. Thank you.
Thank you, Diana. Now, Jackie Kuhn, representing the Florida Restaurant Lodging Association, one of our favorite segments of the community, our restaurants. Jackie?
Thank you for letting us join such a distinguished group. I am a member of the Florida Restaurant and Lodging Association here in Collier County and also a owner at CJ's on the Bay here on the island. We are also, all restaurants are following the mandates as defined by the CDC in the state of Florida, which includes restaurants as defined is restaurants that serve over 50% food. We are at 50% capacity. We are doing this by removing tables as well as spacing tables out to be 6 feet or greater. We are also asking all tables and parties to be less than 10 apiece. We are also doing employee screening with trigger questions that have been defined by the CDC. We are practicing rigorous cleaning and sanitizing efforts for our employees as well as for our guests. And many of our restaurants here on the island are doing takeout and delivery services. We are committed to the safety of Marco Island for our employees as well as for our restaurants. We are here for you, and we hope to be here for you in the future. Thank you.
Thank you, Jackie. So the other two things I want to do are talk about what's happening at City Hall specifically, both externally and internally, and then talk specifically about the hot issues of the day that people seem to be most concerned about, and give you some assurance what's happening there. The city of Marco Island has been under a declared state of emergency since Monday evening. What that means is that triggers structure for the city's emergency response as guided by the Federal Emergency Management Association, which is exactly the same sort of thing that we take on when a hurricane comes. We go into the same sort of an incident command structure to help us organize our response to this, what we call an incident, this public health incident. We have also begun in a limited way to have City Hall employees who can do it to telecommute. So we have fewer people in City Hall. We're giving people the opportunity to work from home where it works for us. We haven't yet closed City Hall, but we certainly encourage anyone who's doing business with the city to please do it online or by telephone if it's at all possible. There are very few things that can't be done either online or by telephone, and if they can't be, either consider putting them off for a few weeks or just putting them off entirely. If you really need us, call us and we'll make some sort of arrangement to work that sort of thing out. We, as I hope most businesses have instituted some additional cleaning protocols. We have some full-time people who are helping us keep our public spaces clean. And we're also focused very much on continuity of operations. There are many businesses that can close. We cannot close. We need to provide police services, fire services, water and wastewater services, public works services with our road system. So we don't have the option of closing. So we are doing the very best we can to preserve the health of our employees, to follow the precautions that are put out for us, which we continue to look at. We've been working for a couple weeks on things like telecommuting and trying to help be sure that we're doing what we can do. The other two things I want to talk about are, as I said, the hot issues of the day, which seem to be activity in the restaurants, which we've already heard a little about, and activities last. I want to talk about the beach. We have Marco Island police officers who have copies of the governor's order, which was issued yesterday, which defines the guidelines for our restaurants and bars and how their activities are being restricted, that we're going to be hand delivering to each of those establishments. And here's what we want to make clear, that what's at stake for people who don't want to comply is their license to operate. And we really don't want to be holding that over anyone's head, but people need to understand this is important. And those who choose not to follow the guidelines and behave in what we believe and what the state and federal governments are saying is a responsible way, put their operating license at risk through the State Department of Professional Regulation. So people need, and we will be communicating that directly to individual restaurants. And that's very important. The other thing is the beaches. People are very, very concerned about visitors coming to the beach and bringing risk to the rest of the island residents. Now, the truth is, activities on the beach, and we've been monitoring closely. We have community service officers and police officers who have been monitoring activities on the beach. For the most part, people are cooperating very well with the guidelines as issued by the CDC, groups of 10 or less. They're staying fairly far apart. Today, specifically, we kind of had an uptick in activity this afternoon, which I think is going to make what I'm about to say even more important. And again, today being March the 18th, as we're recording this, the Collier County government has announced that they are closing beach parking in all the public spaces on Marco Island. That means the Tiger Tail parking lot will be closed and the South Beach parking lot will be closed effective at dusk today. March the 18th. Now, they're not closing the beach. We're closing the parking. And that's important because the philosophy is by closing the parking, we severely limit the number of people who can get to the beach at any given time and makes it much easier to ensure that people are adhering to the social distancing guidelines that are being put out for us. Also, the Marco Island Civic Association will be closing at the end of the day today the Sarazen Park parking, partly because it's proximate to some of the other county parking and there could be a lot of confusion about who's open and who's closed. But that beach parking will also close at the end of the day today. Now, I've spoken with the folks at the Civic Association at MICA, and they are, for the time being, leaving the Residence Beach parking lot open. That's, as you know, available only to residents of Marco Island who have purchased that membership to be able to have a beach parking pass. They have committed to very aggressively monitoring attendance, monitoring activity, educating beachgoers, and ensuring that the CDC guidelines are closely watched and adhered to. They're putting additional staff on, and they're putting up signage to be sure that that those things are followed. And they've said they will continue to monitor that activity and make further adjustments if they feel like it's merited. And I've spoken to them at length today. That will continue to happen, and we will continue to adjust as we need to, I think, and they'll certainly be wanting to do that as well. So those were the two things that have been points of contention today, and I hope people feel like addressing those issues helps with them to understand what's happening out there in the world to help mitigate the risks for all of us here on the island. The only other thing I want to say today is, that, as you know, and as all these people know, and we've talked about before we had this session, we're all in uncharted territory here. But what's really important as we establish our protocols and react on a day-to-day basis as this changes, and it's changed very rapidly as we've gone through it, is that we all need to behave thoughtfully and rationally. And we all need to understand, for one thing, how our behavior affects other people. And I'll give you an example. If you own a restaurant and you have 30 or 40 people having a party, you might think, well, we're fine, we're healthy, we're not going to have a problem. But that doesn't affect just you. Think about the 80 or 90-year-old resident who lives a block away, who sees that, and their level of anxiety and their level of fear about nobody doing anything about this epidemic is ratcheted up just because that's happening. That's you not doing your part to keep the anxiety and the fear in the community down. It's not just about you. It's about our other older residents. It's about the people who might be at risk, even if you're not. If your behavior helps contribute to community spread or to the exposures as it might pass from person to person, then you're not helping. So everybody needs to look not only at their own behavior in terms of how they're mitigating their own risk from the disease, but what they're doing that might ratchet up not only the risk, but frankly the anxiety among our other residents who maybe aren't quite as hale or healthy or young as you might be. So I implore everybody, let's be good neighbors. Let's work together. On the other side of the coin, I want to borrow from President Roosevelt, who said, the only thing we have to fear is fear itself. So on the other side of the coin, we all need to not panic. We need to pay attention to our health officials and closely watch those guidelines, act thoughtfully and rationally, keep an eye for your neighbors. You know, if you find someone who's having trouble getting food, we have contact information on the screen, websites and telephone numbers you can go to plug us in. Let's help the people that need help. We'll all work together and we'll all get through this epidemic together. And with that, I think that's all I've got for now. And if this format seems to work, if people respond positively to the information we're giving, we will do this again based on the issues of the day. And with that, everyone stay safe, wash your hands, and stay calm, and let's get through this thing together. Thank you for your attention today.